안녕하십니까?
Hello, I am Dr. Son Young-hee from Ijon Dental Office. Today, I'm going to talk about use of drug for implantation, and we'll talk about the drugs that we use in a dental office. First, let's talk about the general stuff of drugs and antibiotics. In general, we prescribe medications to patients every day. Let's have a look at how they are classified. Classification of drug risk. This is the most commonly used category from FDA. The pregnancy category that would affect the fetus. FDA Pregnancy Category has 5 categories: A, B, C, D, and X. As you go toward A, it is safer, and as you go toward X, the risk goes up. FDA drug classification. Most drugs fall into B, C, and D categories. But you need to understand that drugs in categories B or C can become category D when they are used for a very long period of time. Category A, hardly any drugs fall into that category. Maybe multivitamin, but megavitamin is not included in category A. Category B, risk to fetus is not demonstrated in animal experiment, and there is no clear evidence how it affects humans. Category B includes insulin, acetaminophen, cimetidine. Category C, in animal experiment, risk to fetus is shown, but there is no clinical study results on humans. So it's a drug that may affect human fetus, and there is no human or animal clinical studies. Benefit from using the drug can outweigh the risk. Only then the use is allowed. Category C includes aspirin, heparin, propranolol, carbamazepine. So these are in category C. Category D, risk to fetus is shown, and the drug has more benefit than the risk if it is used by a pregnant woman. So that is category D. The drugs can be used by a pregnant woman when in a life-threatening situation and no other effective drugs are available. It includes antibiotics like phenytoin, phenobarbital, aminoglycoside, and tetracycline, and antihypertensives like B blocker, ACE inhibitor. Category D also includes alcohol, the one that we drink a lot. Category X, these are the drugs that have shown risk to the fetus of both animals and humans. Warfarin, vitamin A, and isotretinoin, which was used for pimples in the past. So that's category X. FDA also defined teratogenic drugs. These are the drugs that can cause abnormalities in the fetus. This is strictly prohibited from using on pregnant women. So tetracycline may be the only drug in this category that we may use. There are drugs we need to be careful in using for pregnant women. But in a dental office, when we prescribe these drugs, actually we should not prescribe them except aspirin. So we don't need to use the rest of the drugs in a dental office. Anticoagulants and aspirin need to be cautiously used for pregnant women. But there are more pregnant women who use aspirin than we think. I will explain it later. Antibiotics, aminoglycoside, and gentamicin, and neomycin. We need to be careful in prescribing aminoglycoside for pregnant women. We also need to be careful in prescribing beta blockers. Vitamin A should not be prescribed. Alcohol and smoking are not indicated for pregnant women. Not only FDA, but Wayne State University also came up with Teratogen rating system, which is related to causing abnormalities to fetus. This is for your reference. Class 0 is the least risk drugs. Acetaminophen, aspirin are in the class 0. Class 1 is minimal risk, class 2 small risk, class 3 moderate risk, class 4 potent risk. So there are 5 classes in terms of causing abnormalities in pregnant women. Next, a drug interaction. When we administer each drug, the efficacy can increase or decrease beyond its own level. Synergism is the effect of the drugs greater than the sum of the individual effects of drugs. And the opposite is antagonism. Synergism has 2 interactions, additive and potentiative interactions. Additive interaction means when 2 drugs are combined, their effect would be 1 plus 1. And the potentiative drug interaction means the effect of individual drugs is greater than the sum. On the other hand, antagonism, the drugs would nullify or reduce the effects of other drugs, so there is no reason why we need to use the antagonist drugs. When we use antibiotics, potentiative interaction or antagonism interaction is something we can experience. We already know bactericidal effects. When 2 of them are used, we would get potentiative effect. But when we use bactericidal and bacteriostatic agents together, antagonism would be the result, and bacteriostatic plus bacteriostatic would result in potentiative result. I will not explain bactericidal and bacteriostatic drugs as you already know. So these antibiotics, so most commonly used ones also have potentiative interaction. The representative potentiative drug interaction is shown by penicillin plus aminoglycoside. But aminoglycoside is hardly used for prescribing for outpatients. So penicillin plus clavulanic acid is effective for penicillinase producing bacteria. Augmentin is the brand name, which is utilizing the potentiative interaction. Antagonistic drug interaction, they should not be used together. Simply put, penicillin and tetracycline, because penicillin has the bactericidal effect and tetracycline has the bacteriostatic effect. So they should not be used together. Other drugs, if you look at the drug interaction, let's look at the representative ones. Penicillins would lower the effect of oral contraceptives. If you look at the pharmacopedia, this appears quite a lot, but all antibiotics actually lower the effect of oral contraceptives. Cephalosporin used with alcohol would cause withdrawal. Tetracycline antibiotic would lower the drug effect if used with cimetidine or milk, because when tetracycline is used with the chelate agent like metallic salt, which adheres to the tetracycline and gets discharged together, so there is no effect. Acetaminophen should not be used for patients with angina. Nitroglycerin, which can be fatal. Mefenamic acid, representative NSAID, it is also called Pontal. It should be taken with copious water, food, or antacid agent. To reduce GI disorder, most NSAIDs have these characteristics, which will be explained later. So that has been brief general summary, and let's look at in more details. First, antibiotics. The representative antibiotics would be penicillins, ample spectrum penicillins, and penicillinase and beta-lactamase inhibitors are the two categories. Ample spectrum penicillins, we use amoxicillin quite a lot, so that is the basic penicillin. Penicillinase and beta-lactamase inhibitors. So the penicillins would include generally amoxicillin plus clavulanic acid and ampicillin plus sulbactam. So these are the representative ones. There are many antibiotic types, starting from group 1 to many groups. Group 1 is ample spectrum penicillins, amoxicillin, and ampicillin. Group 2, penicillinase and beta-lactamase inhibitors. Representative 1 would be Augmentin and Unacin. Methicillin is included in group 2. Methicillin is important, which is not used quite often, as in MRSA, methicillin-resistant Staphylococcus aureus is the standard for antibiotics resistance. Piperacillin plus tazobactam, ticarcillin plus clavulanic acid. These are used but for severe infections. Group 3 is Cephalosporin generation 1. Group 3, Cephalosporin generation 2. We use these drugs quite a lot. And Cephalosporin generation 3 and generation 4. Group 4, macrolides and lycosamines. These are used more than we think. Erythromycin, clarithromycin, and clindamycin are used quite a lot. The representative erythromycin would be Zithromax. Cleocin is representative clindamycin. Erythromycin and lincomycin are used often too. Group 5, quinolone. There are 4 generations of quinolone, I think. And that there are some differences between the generations. Generation 1 starts with ciprofloxacin. Quinolone includes ciprofloxacin, levofloxacin, ofloxacin, and sparfloxacin. Group 6, carbapenems. Group 7, and Group 8, aminoglycosides. Group 9, 10, tetracycline is Group 10. Vancomycin, we haven't used it, but it is well known, and it is in Group 9, glycopeptides. Group 11, sulfonamide. Group 12, 13, and 14. There are many, and 15, up to 15 others. The catch-all category. So there are so many types of antibiotics, but clinically, we use these common antibiotics for prescriptions. Let's have a look at them. First, amoxicillin, which is used most frequently. It is under the FDA classification Category B. Amoxicillin is used more than ampicillin because it can be absorbed better. Indications: to get the full reimbursement under the national health system, it should be used for infection after extraction. That is the dental indication. So this can be prescribed. The dose is 250 to 500 milligrams 3 times a day. As you know, It is not effective for beta-lactamase producing bacteria. Common side effects include diarrhea and nausea, and it reduces the effect of oral contraceptives, anticoagulants, antihypertensives. Amoxicillin is the standard antibiotics, so you need to start with it. Next, Augmentin. It is in the FDA classification category B. Augmentin is used with clavulanic acid, effective for beta-lactamase or penicillinase producing bacteria. So it is an antibiotic used with clavulanic acid. Dosage broadly 187.5, 375, and 625 milligrams. Amoxicillin 125 plus clavulanic acid 62.5 is 187.5 milligrams. The most frequently used dosage of 375 mg is composed of amoxicillin 250 and clavulanic acid 125. For 625, amoxicillin is only increased to 500. Efficacy and effectiveness also includes dental infection. For 12-year-olds and older, or children with 40 kilograms or heavier, 250 mg amoxicillin 3 times a day can be used. That means Augmentin 375 milligrams 3 times a day. For a severe case and respiratory infection, 625 milligrams can be used. For dental infection, the standard is amoxicillin 250 milligram for a single dose 3 times a day for 5 days. That is 375 milligrams of Augmentin. Augmentin needs to be compared to Cephalosporin generation 2 because they have similar efficacy. So you can prescribe Augmentin or Cephalosporin generation 2.
세팔로스포린 2세대를 처방을 하시는 게 맞다고 생각을 합니다. 그다음은 우나신입니다.
Next, Unacin. Augmentin was patented by GSK, GlaxoSmith, and the patent was expired a long time ago. There are many generic drugs. Unacin has similar efficacy and made by Pfizer. The patent was expired too, and there are many generic products. And they have similar efficacy. Those two, ampicillin plus sulbactam. Ampicillin 250 milligram plus sulbactam 125 milligrams. But now, ampicillin and sulbactam are ester bonded and absorbed in the intestines, so they are separated in the body. So now, and it is also called sultamicillin tosylate. An injection type is also available. If you use Augmentin, you don't need to use Unacin. You can choose either one of them. There's no difference between them. These are the indications. The problem is there's no dental indication. Next, cephalosporins, generation 1, 2, 3, and 4. The reason why they have different generations is that gram-negative effect increases as the generation goes up. The first generation cephalosporin, cephradin. Cephalosporin falls in the category B of FDA classification. It is stable under penicillinase and beta-lactamase. It is not metabolized and discharged in urine, so it is very good for urinary tract infection. Depending on the severity, 250 to 500 milligrams can be used 3 to 4 times a day. We usually use the second generation cephalosporin. The second generation cephalosporin can be represented by Cefacla, which is used quite a lot today. So it is effective for gram-negative as the generation of the product goes up. In early oral infection, gram-positive is predominant, which does not require the use of the second-generation cephalosporin.
이런 것들을 사용할 필요가 없다는 거죠. 그래서
So this should be used after pus is made. After the intermediate stage of infection, I will talk about how it can be used later. For adults, 250 milligram TID or 375 milligrams BID. For children, 20 milligrams per kilogram per day and up to 1 gram a day can be used. Cephacla is used quite a lot because the absorption rate is not affected by the intake of food. It can be taken before or after a meal, and it can be used without changing dosage for patients with renal disorders. So Cephacla is used quite a lot.
안정성이 좋은 약이기 때문에 세파클러를 많이 사용을 합니다. 그래서 따라서
This can be used for children. That is a pretty good option. Next, in a dental clinic, Metronidazole plus Spiramycin. They don't sound familiar, but you know Rhodozil, which is Metronidazole plus Spiramycin. Rhodozil combines Metronidazole under 25 milligram and Spiramycin 750 KIU.
그래서
Gram-positive, anaerobic, gram-positive, gram-negative. So it has effect for all of those. So Spiramycin is for gram-positive aerobic, Metronidazole for gram-negative anaerobic. However, in Korea, the drugs on the market, I believe, are Combipam and Rhodozil. There may be others. Metronidazole is attached to anaerobic gram. I don't think it's a good idea if you use it a lot. More stable drugs are available, so I believe you need to try to avoid the drug. It's not good to develop sensitization to this drug, so I believe it's not good, and I don't use it often. I rarely use it, and I don't recommend the use of it. Oral metronidazole is not really used in the medical area. For 15 years old or older, 2 pills at a time, BID or TID. For those on anticoagulants, they should not be used. The drug can be transferred to breast milk. While on the drug, urine can become dark color because of metronidazole. Next, quinolone is also used quite a lot in the dental clinic. It is a drug of choice for penicillin allergic patients. It is actually effective in a urology or eye diseases rather than dental use, but it is also indicated for tooth-related diseases. Its advantage is that it can be used BID twice a day. If someone has allergy against the penicillin, this can be used. Next, macrolide. Roxithromycin is the drug used quite often. Macrolides are very stable and they can be prescribed for patients allergic to penicillin. It is not contraindicated to any age groups or pregnancy. It would be good to remember roxithromycin, 150 milligrams BID or 300 milligrams once a day before meals. Pretty good drug. Next, low-dose doxycycline or tetracycline can be prescribed after period treatment. Doxycycline, the standard dosage is 200 milligrams a day. Low-dose tetracycline dosage is 20 milligram BID for period treatment. And it is in total of 40 milligrams. which is a very low dose, can be prescribed during or after period treatment for 4 weeks. But it is category D of FDA safety category, so you need to be careful in prescribing it. It has been commonly used antibiotics. When we prescribe antibiotics, we need to consider patterns. Monotherapy. A single antibiotic can be prescribed, or combination therapy can be adopted. Amoxicillin, cephalosporin, quinolone, macrolide, tetracycline can be used for monotherapy. For combination therapy, Augmentin, Unacil, Rodozil can be prescribed, but unknowingly, 2 drugs are used. So, monotherapy or combination therapy can be chosen. When there is infection, combination therapy can be used. For preventive purpose, there's absolutely no need for combination therapy. The second pattern of antibiotic use is for preventive purpose or therapeutic purpose. For preventive purpose, before or after extraction of wisdom tooth, before or after implant surgery, or to prevent systemic tooth-borne infection. For therapeutic purpose, when tooth-borne infection occurs, it is to treat space abscess, alveolar abscess, or sinusitis, or osteomyelitis. So for different purposes, we need to choose appropriate antibiotics. The selection guide. Before extraction or surgery, is it good to use preventive antibiotics? Generally, the answer is yes, but there is no significant difference. However, when a problem occurs, whether we used pre-op antibiotics or not, that makes a difference. So, I recommend that you use pre-op antibiotics for preventive purpose, and amoxicillin is the standard. For that, whom do we need to prescribe it, and who must have amoxicillin prescription? This is most important to prevent infective endocarditis. For such patients, prophylactic antibiotics needs to be prescribed according to American Heart Association 2007, and it is continuously revised since then. Indications of prophylactic antibiotics: prosthetic cardiac valve, previous infective endocarditis, congenital heart disease, and cardiac transplantation recipients. Patients with such conditions need to receive prophylactic antibiotics. Amoxicillin needs to be prescribed. That is a standard recommended by AHA. How do we need to administer them? Oral amoxicillin 2 grams, that is 4 pills of 500 milligrams, taken 30 to 60 minutes before surgery. For children, 50 milligrams per kg. If oral administration is not possible, amoxicillin, cefazolin, amoxicillin 2 grams IM or IV, or 1 gram of cefazolin IM or IV. Penicillin allergic cases, cefazolin, ceftriaxone, clindamycin, clarithromycin can be used. We need to remember that amoxicillin is the standard. For penicillin allergic patients, I believe you know what type of antibiotics need to be used. Next, when it is used for therapeutic purpose, we talked about preventive purpose before. Microorganisms from the odontogenic infection have been isolated. Streptococcus viridans occurs most frequently. So for therapeutic purpose use of antibiotics, we need to use the ones susceptible to Streptococcus viridans. So which antibiotics show sensitivity to the infection? Vancomycin, teicoplanin, chloramphenicol, ofloxacin, imipenem, erythromycin have the high sensitivity. Intermediate sensitivity, ampicillin, sulbactam, clindamycin, ciprofloxacin, and high resistance is shown by cefazolin, oxacillin, ampicillin. So monotherapy antibiotics. Actually, ofloxacin and erythromycin are the ones we may use. Vancomycin, teicoplanin, and imipenem are very expensive and we don't have to use them. You can start the antibiotic regimen with intermediate sensitivity. For therapeutic purpose, we need to understand at the early stage, before pus is created, penicillins are effective for aerobes. Once pus is made, early aerobes would be replaced by anaerobes. Then you'd better change the antibiotics susceptible to anaerobes. So you need to start with amoxicillin at the beginning. Once pus is made, cephalosporin second generation or above, macroclides or quinolone need to be used. So you'd better not to use the second group of antibiotics from the beginning. And if there's a stiffness, you need to use amoxicillin. When pus is made and the situation is localized, antibiotics need to be changed. I have been talking about the general summary of medications and antibiotics. More detailed information will be provided in a training course. As I said before, you should not prescribe just one kind of antibiotics depending on the severity of a disease. And depending on the situation, you need to change the use of antibiotics in order to better control the symptoms on the part of a patient. So today, I've been talking about a general summary and antibiotics. Thank you for your attention.